Dr. Shagun, welcome you all for this Facebook Live session. We have Dr. A.K Dhar with us, a very renowned medical hemato-oncologist of national repute with more than 30 years experience. In next 15 minutes, he'll tell the audience about breast cancer management. I welcome you, sir, on behalf of AOI Gurugram.
Thank you, Shagun. And I hope that in next 15 minutes, we will be able to give some important information to our audience.
So, sir, let's start with this session. So, what is breast cancer?
See, Dr. Shagun, you have chosen a very important subject. Let me introduce this subject a little bit for the sake of audience. This topic is important because breast cancer has become one of the leading causes of cancer deaths, not only in the world, but also in India, to the extent that it has surpassed the cancer deaths caused by lung cancer. And it is rapidly increasing in our country because of so many reasons which we will be discussing subsequently.
So, sir, what about the global incidence of breast cancer?
See, global incidence, if you ask me, the incidence all over the world of breast cancer has been rising steadily. And if you see that we report about 2.3 million breast cancers every year all over the world. Not only in the world, but the incidence of breast cancer is rising in India also, and it constitutes about 11 to 12% of all cancer in India. And you will be surprised to know that the incidence of breast cancer has rapidly increased in last 50 years to the tune of 50%. That means if we were getting 100 cases of breast cancer in 1970s and 80s, now we are getting 150 cases of breast cancer. So that is a very, very significant jump as far as the breast cancer incidence is concerned in our country.
And sir, what about the scenario of this disease in India?
Yeah, I told you that this is very, very rapidly increasing in our country, and there has been 50% increase in last 4 to 5 decades. And it has been estimated that about one lady out of 15 or 16 ladies will suffer breast cancer in their lifespan. So with this increase in the breast cancer, we can say that we are heading towards a breast cancer epidemic in our country, and we need to take care of and take precautions for preventing this cancer.
And sir, we have heard that from various agencies that breast cancer is rising. Dr. Dhar, can you tell us whether this statement is right? And if that's so, what is the reason for that?
It's absolutely right statement, Shagun, because if you see the urban population in India, the breast cancer is increasing in the urban population. Initially, about 4 to 5 decades back, cancer cervix was the commonest cancer in our country. But now that paradigm has shifted to breast cancer, and breast cancer is increasing in urban population, where the cancer cervix has been more in the rural population. So that is the situation as far as breast cancer is concerned.
So moving on to the next question, sir. So what are the warning signs of breast cancer, and what are the ways and means to catch it at the early stage?
Yeah, that's a very, very important and very good question, because unless until we catch the disease at early stage, we won't be having results, and we want good results. By asking this question, you have explored a possibility of, you can say, detecting breast cancer at an early stage. So let me tell you how will you detect, or how will you find out whether a patient is suffering from breast cancer or not. The most common symptom or the commonest symptom has been the breast lump. Second is the nipple discharge. It can be whitish discharge or it can be bloody discharge. Both are important. Third is the placement of nipple, or you can say the size of the nipple. If the nipple is retracted, you must get alarmed. Then change of skin over the breast, that is also very important. If you ask me what are the changes over the skin which is important and which somebody should watch out, is that the skin becomes like a pudy orange. You must have seen the orange scalp or orange peel. It becomes like that, and you may have eczematous changes over the skin of the breast lump or breast tissue. Moreover, you may find some nodes in the relevant axilla, like if it is on the right side, you will have right axillary lymphadenopathy, and if it is on the left side, you will have left-sided axillary lymph nodes. So these are basically the commonest symptoms you can have. Sometimes the breast cancer people may have pain, and which occurs at the later stage, but the initial stage, most of the time the pain is not there, and most of the ladies who come to us with breast lump complaint, they do not have complaints of pain but have complaints of lump on that particular side of the breast. So these are the common signs and symptoms. The person should watch it out and take care for early detection of cancer.
And so what all population are at risk of getting breast cancer?
See, whenever patient comes to us and he asks that why I have got this breast cancer. My neighbor doesn't have, my colleagues does not have, my friends, they do not have this breast cancer. So indirectly that lady is asking me that why the breast cancer has happened to me. So one of the most important thing for developing breast cancer is the lifestyle changes, like obesity, like alcohol intake, cigarette smoking. You put on weight rapidly, lack of exercise. So these are the factors. I don't say they are solely responsible, but they contribute to development of breast cancer. Then there are some patients who have got a genetic history or hereditary history of breast cancer. So siblings or the blood relations of that particular patient will develop breast cancer. And there is a gene called BRCA gene, breast cancer related gene, which is responsible for this kind of a family history of breast cancer, and this gene runs into the family. And lastly, there are certain contributory factors like history of cancer earlier in the childhood, and these patients sometimes they get radiation, and people getting radiation on the chest wall. They got increased incidence of breast cancer. So particularly we see in patients of Hodgkin's lymphoma, individuals who have or ladies who have undergone radiation in the earlier childhood, they are likely to develop breast cancer. So these are the factors. I will not say that single factor is responsible for development of breast cancer, but more important is that it is the coexistence of more than one factors or contributing factors which are important for development of breast cancer.
Sir, we have heard that breast cancer is also found in males. How is it that different from females?
Yeah, males are equally, they are likely to develop breast cancer, and the incidence is low, but they are they do develop breast cancer. The incidence is hardly 5% of the women, but breast cancer in men, as we see very often, and the predisposing factors, the biological behavior of the disease, the treatment part is almost the same as in ladies.
And sir, can you please tell us how to perform screening of breast cancer?
Actually, most of the hospitals, cancer hospitals, they got facilities for doing or for conducting screening for breast cancer. And American Oncology Institute at various places do have these facilities of conducting screening. The most important thing is that how to start the screening and what to screen. I think the screening in ladies should be started at the age of 35, 36 years. There are various recommendations, various schools of thoughts, but I will say that it should start at the age of 34, 5, 36 years. And at the age of 40 years, definitely. But those ladies or those persons who have got a family history of breast cancer, the screening should start early, maybe at the age of 30. And the most conventional method has been first the clinical examination by the person or the lady herself, second clinical examination by the clinician, and third by means of mammography. Now the clinical examination by the lady herself is that she should palpate her breast very often, once in a week or once in 2 weeks. There are no certain guidelines, but at least she should be at lookout of having some kind of changes in the breast, which can be in the form of lump, it can be in the form of discharge from the nipple, it can be in the form of retraction of nipple, it can be in the form of skin changes. Similarly, the doctor should also have clinical examination of the breast very regularly done. And once the person reaches that desired age of 40 years for a general population, we should have mammography at least once in 2 years. And that's how we can detect the cancer at early stage.
Let's move on to the next question. Sir, can you tell us the ways and means to lower the breast cancer?
Yeah, very simple. You change your lifestyle changes. I always, whenever I speak to, when I am speaking in some health talks or when I am delivering some lecture, I always say that good lifestyle changes like quitting smoking, quitting alcohol. Some people say, no, a doctor has told me to take 2 drinks of alcohol, 2 drinks of whiskey, so I drink whiskey. That is not correct. Even one drop of alcohol is bad, and people have started realizing it. Then reduce your weight, go for physical exercises, and if you have been exposed or you have got family history of breast cancer, go to your doctor for these things.
And sir, we have heard the term good or bad breast cancer. Can you please explain what exactly it is?
Yeah, good and bad cancer is attributed to the cancer itself. See, there are 4 types of breast cancer. One is hormonal dependent and second is non-hormonal dependent. So usually hormonal dependent cancers are good cancer, and non-hormonal dependent breast cancer, that is triple negative breast cancer, they are bad cancers and they are very difficult to treat. So must remember that triple negative breast cancer are bad cancers and harder to treat.
Sir, audience is eager to know about your experience of treating breast cancer at American Oncology Institute.
Yeah, I've treated several breast cancer patients in American Oncology Institute, both at Imphal and at Gurugram. And I treated one patient of breast cancer in Imphal who was pregnant. So pregnancy with breast cancer is very difficult to treat, but we treated that lady and it was a success. This was a very precious child which was born to a 43 years old lady, and this was the only child she has. And this is about 2 years back, 1.5 years back, and both the child and mother, they are doing okay, and breast cancer is under control.
And sir, how the treatment of breast cancer has progressed all over the years now?
See, the treatment has breast cancer, it has progressed very well, I must say, because the survival about 15, 20 years back, 2 to 3 decades back was only 50 to 60%. Down it has increased tremendously. Newer markers have come, newer molecular markers have come, newer drugs have come, and particularly I would name drugs like trastuzumab, pentuzumab, and other immunotherapeutic agents. So particularly the progress has been made in the field of medical oncology, where newer molecules have given tremendous hope to us. In American Oncology Institute, Gurugram also, I have got some patients who have received these targeted therapy and immunotherapy, particularly in stage 4 disease, and they are all doing well.
And sir, kindly please tell us about the breast cancer in elderly patients.
Yeah, it's a very, very important subject. Now, the whole oncology has been shifted to the elderly population. I got example of ladies who were more than 80 years of age, and we treated them and avoided even surgery in those patients. It is all because of good hormonal therapy and good targeted therapy, and they do well. So I must pass on this information to my audience, is that age is not a bar for treatment, and we have got age related cancer treatment not only in breast but in all other cancers also.
Moving on to the next question, sir, how can we create awareness about breast cancer in masses?
See, you have to set personal example. If you say that I don't eat samosa, then you should not eat samosa in public also. So create personal examples, and lifestyle changes, avoid gaining weight, physical activities, avoid alcohol. That does not mean that you should avoid parties. You go to the parties, but you avoid alcohol, avoid smoking, do your exercises regularly. And if you have been having somebody in family members who is having breast cancer, so take precaution and go to the oncologist and take it as advice, because we have got medicines for prevention of breast cancer also.
Sir, there are so many patients who are not able to afford the treatment of cancer in India. So how can we reduce the cost of treatment in breast cancer?
Yeah, that has been my project since last 30 years, that how to reduce cost. Now what I do is that there is no set guidelines for such patients, but what I do is that I put them on basic medicines which are cheap and got lesser side effects. So the person who cannot afford treatment, he should not be denied treatment. Give some treatment, and I have devised my own protocol which are gradually getting accepted also in international forum also. So you have to devise something new for such patients.
So sir, in the last, your message to ladies to detect breast cancer at early age?
See, early detection is very important. I will request all the ladies to get their clinical breast examination done by self-examination, number one. If there is any doubt, go to the doctor who is expert in looking about the breast part. Get it self-examination very, very regularly by a doctor or by a oncologist. And third thing is, if you got a family history of breast cancer, so you have to be careful, and you have to tell the patients that you have to take precautions regarding this. And finally, I will say that if you detect the breast cancer at the early stage, you will probably increase your survival and patients will do well. Thank you very much.
Thank you, Dr. Dhar, for this informative session. I'm 100% sure audience have gained some knowledge about it.
Yes, I am also sure that people have taken it well and they are educated by my talk. Thank you.